Hi guys, today we are discussing about research approach and research design. Research design is very important while doing the research. Research approach and research designs are two terms that are frequently used interchangeably. However, research design is a broader plan to conduct a study, and research approach is an important element of the research design which governs it. A research design is the framework or guide used for the planning, implementation, and analysis of a study. It is a systematic plan of what is to be done, how it will be done, and how the data will be analyzed. Research design basically provides an outline of how the research will be carried out and the methods that will be used. It includes the description of the research approaches, dependent and independent variables, sampling design, and a plan format for data collection, analysis, and presentation. Definition of research design. The research design is the master plan specifying the methods and procedures for collecting and analyzing the information in a research study. Second definition is it's a blueprint to conduct a research study which involves the description of research approach, study setting, sampling size, sampling technique, tools, and methods of data collection. Last definition is research design is the researcher's overall plan for answering the research question or the testing the research hypothesis. Next, moving on to elements of research design. There are five major elements in a research design. They are the approach, population, sample and sampling technique, time and place of data collection, tools and methods of data collection, and the last one is method of data analysis. First, the approach. It involves the description of the plan to investigate the phenomena under study in a structured or quantitative, unstructured or qualitative, or a combination of the two methods, that is quantitative qualitative integrated approach. Therefore, the approach helps to decide about the presence or absence of randomization as well as manipulation and control over variables. In addition, it helps to identify the presence or absence of control groups for comparison. The approach of research study depends on several factors, but primarily on the nature of the phenomena under study. At this stage of research study, conceptual framework may or may not be incorporated. Second, the population, sample, and sampling technique. Research design also provides the researcher with directions about population, sample, and sampling technique that will be used for the research study. For example, in an ethnographic qualitative research design, a researcher gets the directive that the population will be specific cultural group and the study will include a small sample selected through a non-probability sampling technique. Third, the time, place, and sources of data collection. Time specifying days, month, and year of study, location, study setting, and the sources of the requisite data are the important constituents essential to ensure effective planning to conduct a research study. Next, tools and methods of data collection. This element of research design involves the description of different tools and methods of data collection. For example, questionnaires, interviews, direct observation, or any other methods that suit the particular approach of the research as well as nature of the phenomenon under study. Fifth one, method of data analysis. The research design must also include the description of the methods of data analysis, either quantitative or qualitative data analysis techniques that helps the researcher to collect the relevant data which later can be analyzed as per the research design plan. Without a formal plan of data analysis, a researcher may collect irrelevant data which can later become difficult to analyze. Selection of research design. Research designs or plans and the procedures for research that span the decisions from broad assumption to detailed methods of data collection and analysis. To meet the aims and objectives of a study, researcher must select the appropriate design. The selection of a research design largely depends on the nature of the research problem, resources available, cost, time, and expertise of the researcher, accessibility of subjects, and research ethics. However, the main factors that affect the selection of research design are as follows. First, nature of the research problem. Second, purpose of the study. Third, researchers' knowledge and experience. Fourth, researchers' interest and motivation. Fifth, research ethics and principles. Sixth, subjects or participants. Seven, resources. Eight, time. Nine, possible control on extraneous variables. 10, users of the study findings. First, nature of the research problem. This is the most important factor which helps the researcher to decide about the selection of a research design. Based on the nature of the research problem or phenomenon, researchers decide whether it should be investigated through a quantitative or qualitative study design. For example, a researcher is interested in assessing experiences of the patients who remain on mechanical ventilation. The nature of phenomenon in the given example is qualitative in nature. Therefore, a researcher has to choose the most suitable qualitative study design to study this problem. Second, purpose of the study. Study may be conducted for the purpose of prediction, description, exploration, or correlation of the research variables. Therefore, the purpose of the research study helps the researcher to choose a suitable research design. For example, a researcher wants to predict the effect of music therapy on depression among elderly people residing in old age homes. In this instance, a researcher has to choose one of the experiential research design to study this research problem. Third, researchers' knowledge and experience. Selection of research design is largely influenced by the researcher's knowledge and experience because they avoid using those designs wherein they lack confidence, relevant knowledge, or experience. Hence, the awareness of and expertise in existing research designs are important factors pertaining to the researchers. For example, a researcher lacks the knowledge and experience in conducting the qualitative research. In that case, he may use a study tool, example Likert scale, to quantify the qualitative phenomenon and try to study it using a most suitable quantitative study design. So, researchers' knowledge and experience influence the research design. Fourth one, researchers' interest and motivation. Interest and motivation levels help researchers decide about the particular research design. Motivated researchers always analyze most aspects of research design before selecting one or a combination, while casual and careless researchers may choose research design that may lead to failure. So, if a researcher is not having interest and self motivation to do the research, he can't complete the research on time or accurately. Next is research ethics and principles. The incorporation and application of ethical and legal principles in the research design are essential. This includes moral obligations such as respect for participants and their rights, informed consent, and protection from harm, including any adverse effects to educational progress, health, and well being. Selection of research design is significantly influenced by the ethics of the research study. For example, a researcher may be willing to conduct a research study through a particular experimental approach, but problems of ethical approval may stop the researcher from doing so, and the researcher may have to settle for another available possible research design. So, we have to follow all the research ethics and principles while doing the research. Next, subjects or participants. The number and availability of the study subjects may influence the selection of research design. For example, if only few subjects are involved in the study and an in-depth data is required, a qualitative research design such as case study design may be chosen in such instance. But in case of a large sample, the researcher may opt for a quantitative research design. Next, resources. No research can be conducted without resources such as money, equipment, facilities, and support from colleagues. However, some studies require more resources as compared to others. Therefore, the selection of a research design may be affected by the availability of resources for the research study. For example, randomized control trials require more resources because of randomization and mandatory control group for comparison. Therefore, sometimes because of resource constraints, a researcher has to compromise with non-randomized control trials or non-randomized uncontrolled trial designs. Next, time. Time is also a major deciding factor for the selection of research design. For example, a researcher needs more time to conduct longitudinal studies, while cross-sectional studies may be conducted in shorter time. Therefore, time is also a significant contributing factor in selection of a research design. Next, possible control on extraneous variables. An efficient design can maximize results, decrease errors, and control pre-existing or impaired conditions that may affect the outcome of the study. The maximized efforts of the researcher should maximize control. Therefore, possible control over the extraneous variables may affect the selection of the research design. For example, a researcher wants to conduct a study through true experimental design, but because of the inability to control selected extraneous variables, other similar design has to be opted for, such as quasi-experimental or pre-experimental research design. Last one, uses of the study findings. A research design also involves various methods of data collection and data analysis. Therefore, while choosing a research design, researcher must ensure that Research design is as appropriate as possible for the users of the study findings so that maximum advantage of the results can be obtained. So, these were about the factors affecting selection of research design. Once again, I am summarizing the factors affecting selection of research design. They are nature of the research problem, purpose of the study, researchers' knowledge and experience, researchers' interest and motivation, research ethics and principles, subjects or participants, resources, time, possible control on extraneous variables, uses of the study findings. Next, moving on to validity of research design. There are two important criteria for evaluating the trustworthiness, credibility, and dependability of the research results. First, internal validity, and the next is external validity. Internal validity. It validates whether the independent variables actually made a difference. Did the intervention or treatment leads to the results, or are the results a response to the other factors, that is extraneous or confounding variables? The high internal validity refers to the differences observed between experimental and the control groups that are related to intervention tested in the trial and not because of any other confounding factors. According to Campbell, Stanley, and Gage in the year 1966, six major extraneous variables have been identified that can jeopardize the internal validity. They are known as threats to the internal validity and are as follows. First, history. Second, maturation of subjects. Third, testing. Fourth, instrumentation change. Fifth, mortality. And the last is selection bias. First, history. The threat of history occurs when some event decides the experimental treatment occurs during the course of study, and this event even influences dependent variables. For example, you are conducting a health teaching program on the importance of breast self-examination, while recently a famous film actress is diagnosed to be suffering from breast cancer. It catches media attention. Medical experts are interviewed, and the importance of breast self-examination is supported. All major television channels and newspapers start reporting on the importance of breast self-examination. While you find that the breast self-examination activity has improved, you as a researcher may not be able to conclude if the change in behavior the result of your teaching program or is a result of the diagnosis of the affliction of the movie actress and the subsequent media coverage. Second, maturation of subjects. When experimental research is carried on for a long period of time over a group of subjects, there may be changes in the subjects in different ways. Like in children, there is increase in height, weight, and so on. So maturation is a threat to internal validity. For example, a researcher is interested in assessing the effect of particular nutritional protocol on the weight and height of malnourished children. If this experiment is conducted for a very long period, it is difficult to make out whether the effect on weight and height is due to maturation or nutritional protocol. Next, testing. It refers to the effect of taking a pre-test on the subject's performance post-test. The effect of taking a pre-test may sensitize an individual and improve the score of the post-test. Individuals generally score higher when they take test for a second time regardless of the treatment. Next, instrumentation change. Another thread related to measurement is that of instrumentation. This bias reflects changes in measuring instruments or methods of measurements between the points of data collection. Instruments like thermometer, sphygmomanometer, weighing scale, tape measure, and so on should be checked for their accuracy at regular intervals. The same instrument should be used throughout the study to minimize the instrument-related error of the internal validity. So while doing the research, if the researcher uses different instruments for the study, then the results will be invalid. We can't conclude that it is accurate. Next, mortality. Mortality is the loss or dropout of the study subjects during the course of the study. If the subjects who remain in the study or join later are not similar to those who dropped out, the results could be affected. The longer the period of the study, the more are the chances of subject mortality. For example, the researcher conducting a longitudinal study wherein the subject who participated in first round of the data collection may not be available for the second or subsequent rounds of data collection. Next, selection bias. If the subjects are not selected randomly for the participation in groups, then there is a possibility that the groups that will be compared may not be equivalent. The effect on the dependent variable may be due to some other factors. For example, if two different classes are used to test the effects of two types of lecture methods, or if the subjects are selected in a non-random way, the effect on the dependent variables could be because of other confounders or heterogeneity factors rather than the types of lecture methods. In experimental research studies, the chances of selection bias are minimized by using randomization of subjects in different groups. Next, moving on to external validity. It refers to the extent to which the results can be generalized to a large population. External validity shows under what condition and in which type of subjects the same results can be expected to be replicated, or whether the same intervention will work in another setting and with different subjects. The factors that may affect external validity are Hawthorne effect, experimental effect, reactive effect of pretest, novelty effect, people, place, and time. External validity explores the generalization beyond specific experiments to check if the results and findings are the same with other settings or with other subject population but with related variables. For example, the Newton's law of gravitation is applicable universally irrespective of whether it is an American or an Indian apple. The external validity is ensured by choosing study sampling using random sample selection techniques. Let's see about factors. First is Hawthorne effect. Subjects may behave in a particular manner because they are aware of them being observed, and this is called the Hawthorne effect. Subjects have the knowledge that they are involved in research study, thus affecting the results. For example, a researcher is conducting an observational study on hand hygiene compliance among nurses working in critical care units. In this instance, if the researcher opts for direct observation of hand hygiene complaints among nurses, and if nurses know that they are being observed, they may change their hand washing behavior. Hawthorne effect is nothing but if we are known that we are observed by someone, then we will work properly. So it may lead to error. Next, experimental effect. Experimental effect is a threat to study results when researchers' characteristics, mannerism, or behavior may influence subject behavior. Examples of researchers' characteristics or behavior or facial expressions, clothes, age, gender, body build, and so on. Thus, the way researcher dresses up or the researcher's gender can influence the way in which respondents answer research question. So while collecting data, if the researcher behaves rudely, then the participants they will feel fear to answer. So sense of humor and politeness is important while collecting the data. Next is reactive effect of pretest. The reactive effect of the pretest occurs when the subjects have been sensitized to the treatment because of taking a pretest. People might not respond to the treatment in the manner they finally do if they had not received the pretest. For example, a researcher wants to conduct a study to assess the effect of a health education program on the awareness of HIV or AIDS among people. In this instance, researcher conducts a pretest to collect baseline data before health education. This pretest may sensitize the subjects to learn about the HIV or AIDS, irrespective of whether the health education is provided or not to the subjects. Next is novelty effect. When a treatment is new, subjects and researcher might behave in different ways. They may be enthusiastic about new methods of doing things. Once treatment is more familiar and as the novelty wears off, results might differ. So if a new treatment is given means each individual eagerly they will participate. So the outcome will be good. And if it is familiarized means lack of concentration will be there and the results will be down. Next, people. For example, people of a specific race, such as whites, have high prevalence of coronary artery disease compared to blacks. Therefore, a generalization made for whites will not be applicable for blacks. Hence, this is a threat to external validity. Next, place. For example, the people living at high altitude have high hemoglobin levels because at higher altitude, there is low oxygen availability, due to which there is more production of red blood cells. However, the HB level of the people living on the plains is lower in comparison. So, a generalization for people of hilly areas is not applicable for people living on plains. Next time, if a research was carried out on a community in 1990 and then again in 2000, the results of these two features would be researchers would be different. Therefore, older results cannot be generalized over periods of time as societies and circumstances constantly change. So till now we have discussed about various validity threats of research design. So summarizing, the internal validity factors includes history, maturation of subjects, testing, instrumentation change, mortality and selection bias. And the factors of external validity includes Hawthorne effect, experimental effect, reactive effect of pretest, novelty effect, people, place and time. Hope you all understand about this topic. Thank you for watching. Thank you, Lord, for this day and for all the blessings that come with it. Hope all have the blessed day. Thank you.